Hey, how's it going? It is Dr. D over here at Midtown Optometry, and first off, I just want to say thank you so much for Jill Faso Antonini for putting an amazing post for her son Paul. Paul just recently graduated from our vision therapy program, and she did shared all the photos of the graduations, and there are so many people. I mean, gosh, almost 300 people liking Jill's post, and almost 100 comments on her post as well too. And there's some questions that were on that post that I wanted to answer, and one of them had to deal with a question with Gene. He actually asked, what's going on with the tracking and everything too, and how we evaluate that. Well, first off, what I want to offer everyone is a invitation to come to our office here at Midtown Optometry. We are on March Lane, 2321 West March Lane, suite letter A as in Apple. We're over by the Quail Lakes In Shape, and I want to invite everybody to come out and check us out and get a tour and whatnot too, but also too to pick up one of these awesome informational brochures, really easy to understand and read as well. And what's really neat is that inside the trifold brochure there is a symptom checklist that's on the back that will give parents and teachers a good idea in terms of what signs to look for in the event that their child has a potential learning related vision problem. Okay, so these are completely free. The second thing that we're offering too are workshops, free workshops at the office. We typically do it on a Wednesday, at 6 p.m. And we have a maximum capacity of 30 people per workshop. Okay, so those are also free as well. So if you're interested in setting up a workshop for you and your group and you and your friends or whatnot, PTA, PTO organization, by all means, please reach out to me. Just comment below or shoot me a message, and I'll be more than happy to check our schedule and make something happen. Okay, so one of the tools that we use to evaluate things too. Hey Felicia, what's up? May, thanks for jumping on our live. But one of the things that we look for is, first off, there's more things involved than 20/20 eyesight. A lot of people unfortunately believe that 20/20 is perfect vision, and it isn't the case at all. Okay, matter of fact, 20/20 is just one of the visual skills. There's actually over 17 visual skills that's critical for reading and learning, and the clarity, the eyesight measurement of 20/20 is only one of those, and there's actually way more than that. But one of the tools that we actually use is called a readalizer, and a readalizer is looks like hem goggles. Okay. And in the readalizer goggles, there are actually infrared sensors that's built into the goggles. And what it does, it actually tracks the eye movements, eye tracking movements of the child, of the person that we're testing. And so in the readalizer pamphlet or booklet here, there are passages that's age, that's based off the age. And so, if they're in first grade, second grade, third grade, so on and so forth, there's age-specific passages that they would read, but also too, there will be yes/no comprehension questions that will be asked as well. Okay, and so while the patient is actually reading this passage to themselves, the readalizer goggles, our program will track that and print out a report. Okay, so a report, what the tracking system looks like, it looks something like this. Comes out like so. Has a right and left eye, tracking and everything as well. A bunch of data showing that it's being recorded appropriately. And what's great is that it also shows a really awesome report. Okay, and what this basically means is that the squares, by the way, and the lines, first off, there's two visual skills that's really critical for reading. Okay, one is called a fixation, and the second visual skill is called a saccade. And a fixation is where both eyes, they fixate on the word, and a saccade is eye movement of both eyes to the next word, right? And so you can see here, here's a fixation, a saccade, another fixation, a gigantic saccade, and what I'm showing here too, the saccades, by the way, usually really really fluent readers, really awesome readers, usually don't read every single word, right? And so this is a beautiful report, and it just shows how awesome the fixation saccades are. And so there's some regressions here, but overall looks really good. And this person, this patient actually did really, really well on their report. Okay, so in comparison, we have another patient. Their eye tracking scans are right here. All the data is right there as well. And then as you can see here, you can see that there's a bunch of fixations, a saccade, a lot of regressions, and I don't know if you can see that down here. That is not a very good report at all because of all these fixations, saccades, regressions, and that's no bueno down here. Okay, so by able to show mom and dad, teachers, parents, OTs, PTs, school psychologists, IEP specialists this report for their child or their student that is struggling in school, we just show them this is that, hey, little Johnny, little Sally has a eye tracking problem. They're not stupid, they're not dumb. Their eyes are just not allowing them to do what they got to do. And that's why they're struggling in school. One of the main reasons why. But eye tracking, is one of the main things that happens in a lot of kids that we see, and we work on that too. So that's one aspect. But in any event, that's one of the things that we utilize to diagnose a child as such. And we want to go ahead and make sure that your child isn't struggling in that way. Okay, so first what we got to do is schedule a baseline comprehensive eye exam, and then after that, if the exam findings show that further testing is needed, then we'll go ahead and schedule a binocular vision evaluation, otherwise known as a BVE, at our Vision Development Center next door. And we do that on another day, of course. We preferably we do that in the mornings. Because we want our patient to be 110% well rested, fed belly, guns blazing, just coming in just crushing it, right? Versus we don't want them to come in after school where they're where they're all exhausted and cranky and everything too. We want them in the most optimal case possible. Okay, so we usually do it in the morning during the week, right? And so after that, a week later, mom, dad, parent, guardian will go ahead and sit down with Dr. Leanne, go over the results, go over the findings, get every questions answered on the planet, and we'll go ahead and discuss a treatment plan for these learning-related vision problems that, by the way, are oftentimes misdiagnosed as ADD, ADHD, dyslexia. We do see a lot of kids with autism that have also kids with visual processing disorders too. And what's interesting about visual processing disorders is that a lot of IEPs have those listed, and they do diagnose it, and the schools, unfortunately, they leave the treatment plan blank. And that's what's alarming to me, is that the IEP specialist, whoever's doing the IEPs, they do acknowledge and identify a visual processing disorder, but there's no treatment plan listed. Guess what the treatment plan is, everyone? Vision therapy. So, we want to go ahead and get this out to everybody there too, especially if the child has had an IEP, especially if they're struggling in school, especially if they've been diagnosed or in the process of being diagnosed or testing for ADHD, kids with autism. It is just so crazy that the identification is there, but a treatment plan typically isn't listed. It doesn't make any sense to me. So hence the reason why we're doing this Facebook Live, right? So I encourage everybody, especially if you're a parent or a teacher or OT or PT or speech pathologist, school psychologist, pediatrician, anybody who's involved in a child's academic and overall development over, the course of 18 years, right? Please share this video and make an appointment at our office, Midtown Optometry. Go to midtownoptometry.com and you can have real-time access to our appointment book schedule. Give our office a call, 209-957-8000, or you can simply go ahead and find us on Facebook, on Instagram, and just shoot us a message too. We're really responsive in that regards as well. Okay, so hopefully that was really cool. I just want to just show you a little tidbit about the Readalizer, one of the many tools that we use at the office. Of course, not the end-all be-all. And please stop by the office, grab one of these brochures, grab a couple, heck, and share it with your parents, your teachers, and bring it to your school site. And again, I'll be more than happy to do a workshop for your group. Okay, just shoot me a message if you're interested. Okay, thank you so much for watching. Please share this video. I would greatly appreciate it. And if you put hashtag shared in the comments section, I'll give you guys a shout out too. Thanks, guys. I'll talk to you guys later. Dr. D, I'm out.